Geography should never determine whether a patient lives or dies. Our next guest, Dr. Sarah Matt, is on a mission to make that vision a reality. A surgeon turned health technology strategist, Sarah has spent over 2 decades breaking down the barriers that separate patients from care. From leading Oracle's $28 billion Cerner integration to architecting the first U.S. remote robotic surgery network, she's been at the forefront of healthcare's digital transformation. Now, as a national best-selling author of The Borderless Healthcare Revolution, Sarah is equipping healthcare leaders with the practical framework to eliminate physical, financial, cultural, digital, and trust barriers to care. Join us to discover how we can build a truly borderless healthcare system. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Dr. Matt. A big welcome to our podcast. I'm so excited to have you on today.
Thanks for having me, Mike. Appreciate it.
Well, given your remarkable journey from practicing surgeon to health technology strategist, and now a national best-selling author, as well as your leadership roles at Oracle Health and NextGen, and your deep commitment to expanding healthcare access for underserved populations around the world, I'm truly excited to have this important conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast. You will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli on Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and X in order to further the conversations occurring on this podcast. All right, Dr. Matt, it's almost time for our community to learn how you're pioneering the movement towards borderless healthcare and challenging the notion that geography should not dictate the quality of care patients receive. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
Continue to learn. We are ultimately in a ever-evolving landscape, whether it's new models of payment, whether it's new ways of doing things. The AI revolution is here, and every day it can be different. So if you're not learning, you're dying.
It's so funny you mentioned that, Sarah, because here we are in healthcare. You've spent obviously a lot of time in healthcare, and you are continuing to push the bounds of how we should be thinking about the deliverance of care. We're going to talk about that on the other side of the commercial break, but I find myself very fortunate. I get to, advise and mentor a lot of health technology startup entrepreneurs. And one thing I always continue to say to them is like, the longer I've been in this industry, the less I feel like I know, because it is such a complex industry in and of itself. Healthcare is very, very multi-sided. There is a lot of complexity and it's always changing. So, Sarah, I couldn't agree with you more. We have to work from a position that we need to continue to learn, continue to push our thoughts of what we think is true or is right, and making sure that we stay true to that. I think it's incredibly important, especially if we want to be part of that group that is the change makers that are making the difference in moving healthcare. How important has that mindset been through your career? I mean, we got a lot of things to talk about on the other side, but how important has that mindset been to continue to learn? And what has it done for you, put you in the position that you are in today?
I think for me, it's really been the absolute reason I am where I am today. So, when you're a surgeon seeing patients every day, you're really good at that. But doctors are pretty much the dumbest smart people you'll ever meet. And we all know that's true. So when I decided to make that jump, that leap into tech, I knew I needed to retool. And, my MBA at UT Austin, zero regrets. I continue to use those skills every single day. And ultimately, that retool is what brought me into NextGen for my first job in tech, which brought me to doing some crazy M&A I never should have touched, being at Oracle, all the different things. And now bringing this new book into fruition, bringing it to the world, and educating and teaching all over the place the importance of this topic.
Well, speaking of, we are going to unpack that topic and many, many other things, and hearing about your storied career, where you are today now, where things are heading. We're going to talk all about that and more after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we are back with Dr. Sarah Matt, a health technology strategist and now a national best-selling author and speaker who has been doing some incredible work. Sarah, I cannot wait to dive into all of the things that led you up to today. You have a heck of a storied career. You've done a lot of things that many of us hope to aspire to. You kind of teased it on the front end. We're going to unpack that a little bit more. And then, of course, we got to discuss the new book. Congratulations on being now an acclaimed national best-selling author. Incredible work there. We're going to talk about that. And of course, we also got to look a little bit on the horizon. What are you seeing? What do we need to be mindful of the folks that are tuning into the podcast? You know, what's on the horizon from your perspective that we really need to keep into focus? And then can't let you out of here until we can figure out a way or two to figure out how we can continue to help your pursuits and all the things that you are helping lead across our nation. But first, of course, Sarah, take us back a bit, take us behind the scenes. How the heck did you come to where you are today? You mentioned it on the front end, from being a surgeon to going to business school to doing M&A deals, national best-selling author. There's a lot there. How did this all come into focus? Give us a little bit of that backstory that led into today.
Of course. So, as a surgeon, you're taking care of patients every day. People are dying. I mean, it's the hardest work. But during my fellowship, it was half clinical, half research. And during that time, I helped open up a brand new burn lab. And I really realized I had these other skills. And I could plan well. I could ask for money well. I could do all these different pieces. And a lot of providers just like me, they did not like that at all. And so how could I use those skills? And how could I scale myself? So at the bedside, I could maybe see 20 patients a day if I was lucky, maybe more if it was a really crazy day. But how could I help and impact hundreds, thousands, millions, billions of people every day? For me, it wasn't at the bedside. And so, again, I retooled to UT Austin for my MBA and then got my first job in tech. I was a doctor telling people what it's like to be a doctor in a hospital at NextGen Healthcare. But, I had some big fans when I was there. And so I was there for maybe 6 months and they said, hey, how about running all of clinical product management for the division? And I said, yes. Did I know what I was doing? Absolutely not. So it's all about that learning. It's all about that trial by fire. And this is where I really started understanding access, because our customers at the time were critical access hospitals. They didn't have a lot of money. It was during the times of meaningful use 1, 2, 3. And this was a really hard customer and market to work in. From there, I went through other parts of NextGen, patient engagement, worked as a chief of staff, the chief strategy officer, product ops, you name it. And I was like, all right, well, I was in Austin, Texas. And so there's nothing better than riding your bike downtown and drinking kombucha on tap, so I heard. And so I did the startup thing. So I did several startups. The first one was a total bust. That's for another day to discuss. And then I ended up at ESO, which is in the domain still. It's focused on firefighters, paramedics, and EMTs, and a full stack for both of them. So I ran product strategy and UX. And this was just an amazing time because we were building for first responders and COVID hit. So our clients were the people who were there, boots on the ground. In King County, those were our customers. So 2020 was a huge year of growth, of building, of impact. And we were able to exit after that, which was a big deal. So we exited to Vista. From there, I went to Oracle. I built out OCI, so platform infrastructure for healthcare and life sciences around the world. And I got to start working with ministries of health at huge countrywide scale, big pharma, big payers, you name it. And it was exciting because Oracle was kind of the black horse at the time. And we were building these platform elements into new ways of doing things in healthcare, which brought us to acquiring Cerner, which I got to be a part of. I went from being the only doctor at Oracle to having 26,000 new best friends. And it was absolutely crazy. So getting to do the post-close diligence on that, running, pricing and packaging, running, go to market, running strategy, all amazing opportunities for me, and using every single skill that I had learned along the way. And what do you do when you hit that scale, Mike? You go back to startup. So I was with Savata, their Santa Barbara base, and I was their chief strategy officer, focused on remote robotic surgery. So I left them this summer because I launched my book. And so the Borderless Healthcare Revolution, which you mentioned before, just came out last week, and we just hit the bestseller list just yesterday. So it has been a busy and exciting time.
Did you have an author on your bingo card many years ago when you started all of this journey in healthcare? When you were at the operating room table, where you're like, one day I'm going to be an author. That's what I'm going to do.
You know, I don't think I did back then. Over the last couple of years, I've considered it. But when I finally had the opportunity, I just jumped in.
Well, let's go there. I can't wait to discuss it. It is an exciting topic. And of course, kudos and congratulations. We might be the first podcast to gets to announce the said distinction as a national best-selling author. I feel quite humbled and honored, Dr. Matt.
Why, thank you.
Let's go there. Let's talk about it. So before we dive into the book and discuss kind of, what's happening in the book, what you're seeing, what we need to be mindful of, how did it come to be in the first place? Like this notion, and then we kind of framed it up at the beginning, right? And around challenging this notion and orthodoxy that geography should not dictate the quality of care patients receive. And how did this all kind of come to be? Like, what were you seeing? What really said, okay, I now need to go and author this book? What was happening behind the scenes that drove all this?
So, over the years, I've practiced medicine, I've been a tech executive, and everything from those next-gen days working with critical access hospitals to being a Medicare house call practice doc in Austin, Texas. I've seen so many human beings that are struggling so much, but I never considered writing a book about it until around this time last year. So last year around this time, Wiley came to me and said, hey, why don't you write a book? And I said, you do? Okay. What do you want me to write it on? And they said, well, you tell us what's the most impactful and we'll see if it's marketable. And so I really thought about what was going on in the world. And a year ago, we were in a very polarized situation, especially in the United States. And I was thinking through, how could we make a big impact in healthcare? And how could we bring all these polarized groups together? What's a topic that everyone can get together on? Healthcare access. If I ask anyone who's listening to this podcast if they've had a story around access and difficulty for themselves or kids, their parents or friends, everyone has a story. And so this is why I wrote about access, because we can actually make a huge impact if everyone comes together to improve this, not just for the haves or the have-nots or this country or that, everyone, because we all have this problem. It's universal.
It really is. And this is something, and we're starting to see it even more and more. We're starting to see rural and critical access care losing funding, right? This is becoming more and more acute, right? You know it, and I know it. And this is a timely topic. And so, one area that your book introduces is a 5-pillar access audit covering physical, financial, cultural, digital, and trust barriers. From your perspective, Sarah, which of these pillars do you find that our healthcare leaders most often overlook, and why do you think that is?
So I think it's easy to look at digital barriers and think, oh, okay, I can see a path for that. Let's give them good internet. Let's do this. Let's do that. But the trust one, it's hard to do. And so I think a lot of times it's hard for execs on the delivery side, on the tech side, you name it, to say, we're going to improve trust, because they don't know how to measure it. They don't know how to say, this is good for a business. And so when you can't use a metric to measure things, it's hard to manage it, as you know. So of all those things, trust and knowledge, I'd say, is the hardest part and is often overlooked because it's so hard and difficult to measure.
It really is. And these are the things, too, where we start thinking about disinformation and misinformation. And I know there's been some books written on that recently as well, and specific to healthcare. Have you been seeing that part of the issue? Because, like you mentioned just a moment ago, that we are in these very polarizing times, which some of the ingredients that are creating that polarization is this misinformation, disinformation. I mean, just look at what we went through with COVID and vaccines, and we're still there, right? I think we're now getting ready to write black box, creating it as a black box warning. I might be getting the terminology wrong, but a lot of that could be fueled by this kind of mis and disinformation. How much of that is a part of it as well in these kind of current times and over the past number of years that we've been living in that are directly impacting that?
I'd say that for now, it's absolutely impacting it. But at the same time, we've had so many huge cataclysmic healthcare things going on over the last couple of years. Bird flu, COVID, like every day there's something, it feels like. But it's not just that. We have historical mistrust. So there's lots of things that have gone on in the history of the United States, and the history of other countries where certain populations have not been treated well by the medical system. And that doesn't go away. You can't just, wash that off. The other thing, though, is that there's so much information. So, when I was in med school, they gave me a Palm Pilot and it was all advanced and exciting, right? But if any one doctor needs to get information for their specialty, there's too much there. They can't know it all. And so if you're a patient, you're not a doctor, how are you going to understand the information around your illness, your condition? And so because there's so much out there, it's hard to figure out what source is trustworthy or not, and what's the latest and greatest. And so when we think about trust, it's not just patients and consumers, it's docs, it's healthcare systems, because where do we look for our information is important. And when do we update our thought process? That's important too.
I also want to go kind of start global and then get local, meaning let's start talking around the world from your experience. And then I also want to come back to this notion of critical access and rural care kind of facilities. And most importantly, what we're seeing, the alarming rate of closures. I'm going to come to that in just a moment. So let's start more global. And let me set the stage here for you, Sarah. You've worked in settings ranging from Manhattan cath lab to Kenyan community clinics and everything in between, literally a global footprint. From your perspective, what's the most surprising commonality that you found through that journey in terms of barriers to care across these different environments?
So this is going to sound cliche, but every one of those settings has patients. They're all people, and they all have problems that people have. And that's why I came up with the 5-pillar framework, because they all have trust and knowledge issues, whether they are learning about something new, whether they're not sure if they trust something that their doctor or another patient said. They all have to get to an appointment. And we know that whether you're walking a mile or 10 or taking the bus or trying to get your kids to school so you can get to an appointment, it's hard. And then on the culture side, like we all come from different backgrounds, no matter where you are around the world. How does your culture impact how you relate to healthcare? Are you preventative and it's all about wellness, or let's let it ride kind of person because that's how you grew up? And so when we think about the 5 pillars and how it impacts us, the thing that matters most is that we actually have a lot in common. Everyone trying to get healthcare is a patient. And someday we're all going to be patients, whether we want to be or not.
Now let's go there where I was mentioning earlier about kind of rural and critical access care. So we all know the crisis, right? With about 120 rural hospitals closing in just the last decade alone. With that number, so that is unfortunately going to likely accelerate here in the coming months, coming years. From your perspective, Sarah, what are the most actionable steps health system leaders can take today to prevent their communities from becoming these healthcare deserts that obviously are going to be complete tragedies for many of our community members across the country?
So I think we need to think outside the box. If a brick and mortar setting cannot be profitable and we can't maintain it operationally, okay, what can we do? Can we improve the infrastructure? Can we get great broadband coverage into rural environments? And there's lots of places that don't have the infrastructure to do a proper video call. So if patients don't have good cell coverage, good internet, or internet in their homes, or trying to use it in a public place, that makes it hard to get access to some of those actual providers at a distance. So if we can instead bring more tele-operations into fruition in these rural environments, I think that will hold us at a certain point. Now, you're still going to need to get specialist care. You're still going to need procedures and things like that. And so absolutely, we need to find ways to bring these patients to the right places when the time comes. But how can we improve transportation? How can we give waivers for things? How can we make it so it's not a no, there's no way I can do that, but a yes, let's figure this out situation? So I'd say first, aiming at the digital pillar can help us today, and thinking about how to decrease those other pillars so that those patients can make it to the right places is the second thing to do.
And you've also mentioned in the past, and I absolutely love how you framed this up, that you mentioned the digital divide is the new waiting room. I want to say that again because I think it's very powerful, that the digital divide is the new waiting room. And so taking on some of your comments you just mentioned, help our listeners better understand why should healthcare leaders be prioritizing broadband infrastructure over, say, new AI applications or new technologies that have all the bells and whistles and all the rage? Why, from your perspective, should they be prioritizing this?
Because it's going to decrease visits to your emergency room. It's going to decrease chronic care being at its worst. It's going to make sure that the patients that you have in rural environments that you are taking care of in your hospital system don't come to you at the end when it's urgent and emergent. They're going to come and take care of a lot of those things from the get-go. So you can take care of blood pressure and other things via telemedicine. Great. Let's not get those things into an urgency state. So building infrastructure is cost savings. Building infrastructure produces a new revenue stream today because sometimes those patients won't come to you at all. So you're actually increasing your visit volume.
Well, and then let's also talk about, so yes, that is important, building the infrastructure, kind of knocking down that digital divide, if you will, right? That's all important. But then also right on the heels of that is this notion of responsible technology deployment, right? We are going, as well as I do, Sarah, we're going through an absolute rapid change, not just in healthcare, but just the world around this notion of AI, right? You're seeing it just impact every facet of life, right? And so beyond just AI as well, but when you think about telehealth, AI, robotic surgery, and all these other types of technologies and advancements, these types of advancements can either bridge or worsen disparities depending on that deployment. And so from your perspective, Sarah, let's also go there. What does responsible implementation look like versus what you'd consider maybe a harmful deployment?
I think it's about intentionality. If we're going to peanut butter spread some sort of new tech solution, what does that mean? If we're going to instead bring it to one area of our business, what does that mean? I think a lot of times when we say, oh, we're going to use AI X, Y, or Z, well, great. Where are we starting? How are we going to make it successful? And I think a lot of people think that the important part, but the tech is the easy part. It's everything around that that's the hard part. You have to train all the staff. You have to make new policies. You have to govern the data. You have to make sure you have security. How are you going to bring that to scale? And how are you going to do it while still taking care of patients today? So from the get-go, being intentional about where and how you're deploying your new technology is important. Understand which populations it's going to actually impact, also important. I think another question people don't ask today is, who am I not taking care of with this implementation? Or am I excluding people with this implementation? If you answer those questions, you might be surprised on what answers come back. Additionally, a lot of times we buy a new shiny tech product before we actually have a real problem to use it for, because it's, the latest and greatest. I have to have it. Solving urgent and pervasive problems in healthcare will always be a good idea for builders and for delivery leaders. Bringing in the right folks to help make sure that technology is going to actually solve those problems is absolutely imperative. So if it's going to impact the nurses, you should be talking to nurses. If it's going to impact patients, you should be bringing in people from the community, in the communities that will be impacted, around their expertise and experience and how it will impact them. Maybe they don't need this solution you think is so interesting. Maybe they just need a phone call. Maybe they just need something mailed. It really depends. There's simple solutions to simple problems still. And I think that oftentimes we think so big and shiny that we forget that maybe we don't need to solve all the problems. Maybe we just need to solve the biggest ones.
Very well said. And I love the framing of it all, right? At the end of the day, as well as I do, you've been part of startups, you've been part of building, right? Get out of the ivory tower, get out of the academic exercise, get with the end user and figure out what the actual needs are, right? We've seen too many builders build something and then go and try to find a home for it, right? It should be always the opposite. Get on the street, get next to those folks that are the end users to find those pain points. I absolutely love it and could not agree more. Sarah, let's go back to the top again. Congratulations, national best-selling author. Incredible news and much deserved. And so, of course, want to go talk just a little bit about the book in regards to, we don't want to give it all away on the podcast, but before we pull the proverbial crystal ball off the shelf to look a little future state, let's go there for a moment. The book, The Borderless Healthcare Revolution, the definitive guide to breaking geographic barriers through technology. Sarah, in order for our community to say, oh man, I need to go pick up a copy, what are you most excited about the book? What should a hopeful future reader of the book Why should they be grabbing it? Maybe one or two or three things. What has you so fired up about this book?
There's nothing I hate more than picking up a book, reading it, and not knowing what to do next. And so this is an actionable book. Every chapter has a builder's box. I'm a builder. I've been building things my entire career. How can we build access in as a differentiator, good for our business from the get-go? And then there's a checklist at the end of every chapter. So you know what? If you don't read the whole book, look at the checklist. It will tell you, whatever level you are, whether you're a CEO or head nurse on the floor, what you can do today around that chapter to help improve access. So for me, I'm really excited about the actions that are going to be coming out of this book. And I can't wait to see what that looks like once people get in their hands.
I mean, it sounds like there's plenty of other podcast episodes on discussing those exact actions. I mean, I don't know, maybe there's a Dr. Sarah Matt podcast coming that, helps continue to further the good work that's going to come out of the book. I'm just saying.
We might.
I absolutely love it. Well, wonderful stuff. We're going to also ask in just a moment how the listening community can get access to that book, et cetera, and get a hold of you. We'll come back to that in just a couple minutes here. But of course, Sarah, need to pull that, like I said, crystal ball off the shelf a bit. Let's look a little future state. Things are changing so fast. We're seeing it. It's rapid scale right now, how fast things are moving for us in the industry. What is on top of mind for you in your kind of captain's chair, if you will? What are you seeing on the horizon that our community needs to be mindful of that is top of mind to you? Call it next 2 to 3 to 5 years. What's top of mind? What should they be focused on?
So I'd say that the 2026 is going to be the year of catch up. Ultimately, we still have problems with data governance. We have issues with our technology and interoperability. We cannot do amazing AI on non-quality data. So a lot of places, all healthcare systems still have problems with data governance and interoperability. Once we can, again, make those pathways more crisp, understand what good data looks like, we'll be able to train models for our patients with our communities in mind in our types of practices. As we move forward, AI is going fast and furious. And I want to go back to something I said earlier in the podcast. The tech is the easy part. Technology will continue to improve and expand at an exponential pace. No question. I'm not worried about the tech. I'm worried about how do we implement, how do we scale, how do we govern? And so for leaders that are listening to this is not your grandma's leadership discussion. You need to be a new kind of leader. If you can't think outside the box, your whole organization won't be able to either. So we need to bring in leaders that could consider things faster, with less certainty, in the gray zone. They're going to be ready for change and ready to ask the tough questions.
Very, very well said. Thank you for that, Sarah. Of course, now let's come back to current state. We're not going to let you out of here until this community can figure out ways to be helping you and all the things that you're doing to help all of us. So what's one problem, need, or question that you have that our community can be helping you with?
I want us to start the borderless healthcare revolution. I want everyone to make access a priority, whether it's in your life as a patient, in your family, at work, in your industry. And ways that we can do that are first, getting the message out. So my book is out there. You can get it on any website where books are sold. Bring it to your colleagues. Read it as a team. I'm bringing it all over the place, and I'd like you to do the same. If everyone can understand access better, then we can start making those actions that I talked about earlier.
I absolutely love it. Excellent. Well, for our community to have those conversations with you and get involved, how do they find you online, Sarah? Social media handles, websites, or otherwise, how do they track you down?
So the best thing to do is see me on drsarahmatt.com, or you can ping me on LinkedIn. And from there, I'm doing a lot of different things all over the place, and I'd love to work with people one-on-one or with your teams. There's so much good work to be done. So contact me through the contact form. Give me a DM on LinkedIn. I'd love to start that conversation.
Excellent. Of course, for our listening community, just simply scroll on down into your favorite podcast player where you're accessing this episode. All those contact points for Sarah are listed there, or you can head over to our free global online community at passionatepioneers.com. There will be a post for this episode and an area to find those contact points online, as well as being able to leave any comments, feedback, suggestions, or otherwise. And then, of course, head over to places like Amazon or others to track down Sarah's book, The Borderless Healthcare Revolution, the definitive guide to breaking geographic barriers through technology. Sarah, what a wonderful, wonderful time together. So many exciting things happening, and just absolutely think that this is a very timely conversation with the things that are happening inside the C-suites, the leaders of our industry, and even folks all the way down on the front lines and on the ground and facing our patients and our community members. This is needed now more than ever. But of course, before we let you off and get you out of here so you can continue your good work, we have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
we can't make access happen early enough.
Absolutely. Well, thank you for wrapping it up, being succinct, and that is an absolute best way to end this podcast. Sarah, thank you so much for taking the time. We know how busy you are. Thank you for spending time with our community, sharing everything that's happening in your camp and where we can go and go together. So thank you for all of the things you shared with us today, and we're wishing you nothing but the best. But again, thank you so much for being with us today.
Thanks, Mike. Appreciate it.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.